Hello, everyone, and welcome to today's presentation. I'm excited to be here with you. Today, we're going to explore why every man should consider taking sildenafil and tadalafil, even if you already have good erections. The title of our talk is Why Every Man Should Take Sildenafil and Tadalafil, Even with Good Erections. Over the next few minutes, we'll look at what recent research tells us about penile health, how it's connected to overall cardiovascular health, and why prevention is just as important as treatment. So, let's get started and discover why this is a topic every man needs to hear, especially after age 40. Let's talk about the idea of penile prevention after age 40. At a recent sexual medicine conference, a cardiologist was asked a surprisingly simple question. At what age should a healthy man start taking PDE5 inhibitors for the sake of long-term erectile health? His answer was interesting. There's no fixed age, but he emphasized that 40 is a critical point. If you're a healthy, sexually active man in your 40s, and you're committed to maintaining your sexual function for decades to come, then considering low, regular doses of PDE5 inhibitors can actually have real medical benefits. Why is that? Well, PDE5 inhibitors do more than just help with erections in the moment. They improve vascular function, meaning they help keep the blood vessels healthy. They enhance penile blood flow, which is vital for good erections. They also protect endothelial health, the lining of your blood vessels, and this can reduce the long-term decline in erectile function. As one expert put it, if a 40-year-old man told him he wanted to use PDE5 inhibitors regularly to protect his penis, he wouldn't have any problem with that. So, it's about proactive health, looking after your vascular and erectile health early on to preserve it for the future. When we talk about risks for younger men, it's important to realize that the real concern isn't physical damage, but rather psychological. For healthy men in their mid-20s or 30s, the issue isn't that their penis isn't functioning properly. Instead, what's often happening is a subtle but powerful psychological dependency. A man with perfectly normal physiology can start to believe he needs the pill to perform. And what does that lead to? Well, it can cause great erections when he's on medication, but performance anxiety kicks in when he's not. This mental dependence gradually becomes harder to break over time, creating a cycle that's tough to escape. However, there's an important nuance here. PDE5 inhibitors, like Viagra, can actually help restore confidence, especially in men who are anxious. A 2020 study found that about 90% of men with psychogenic erectile dysfunction eventually stop using the medication if they're in a stable and consistent relationship. Why does the stability of the relationship matter so much? Because each new partner tends to bring new anxiety, new adrenaline, and increased performance pressure. These factors can make it harder to relax and trust yourself. On the other hand, a stable partner allows confidence to rebuild naturally, helping you break free from that psychological dependence and regain a healthier mindset. Let's talk about a somewhat forgotten but highly effective therapy, penile injections. Many men have never even heard of intracavernosal injections, yet they are actually FDA approved and can be incredibly successful. In fact, for men with severe erectile dysfunction, these injections can be truly life-changing. This method isn't new. It dates back to the 1980s when doctors discovered by accident that vascular injections could trigger an erection. Today, medications like Trimix and Bimix are injected directly into the penile corpora using a tiny needle, similar to those used by diabetics. When done properly, these injections have success rates of over 90%, even for men recovering from prostate cancer. Now, you might wonder about safety. When monitored correctly, these injections are very safe. The main risk is priapism, which is a prolonged erection, but in well-managed programs, the rate of this happening is only about 0.2%. So, while it may not be as well known as other treatments, intracavernosal injections remain a highly effective option worth considering. So, why doesn't every man opt for injections? Well, the main issue is something called integrability. Basically, if a treatment disrupts the natural flow of intimacy, most men are unlikely to stick with it. Imagine trying to pause a romantic moment just to give yourself an injection. That's not very appealing. Over a span of 5 years, about half of the men who try injections end up discontinuing them. And it's not because they don't work, it's more about the lack of spontaneity. Nobody wants to break the mood for a medical procedure. That said, injections definitely have their place. They are incredibly valuable for restoring confidence, proving that the machinery still works, and helping men recover after prostate surgery. So, while they might not be the perfect fit for everyone, they still play an essential role in certain situations. Let's talk about what we call the silent crisis: erectile dysfunction after prostate cancer treatment. While modern treatments for prostate cancer are quite effective at controlling the disease, erectile dysfunction, or ED, remains a significant issue impacting quality of life for many men. Now, the reality is that about 50 to 60% of men regain their erectile function within 2 years after undergoing prostatectomy, which is the surgical removal of the prostate. However, it's important to understand that several factors influence these outcomes. Age plays a big role, as does your baseline erectile function before treatment, and whether nerve-sparing techniques are used during surgery. These nerve-sparing methods help preserve some erectile function, but they don't guarantee full recovery. When it comes to radiation therapy, the impact on erectile function can be more gradual. Many men experience a slow decline in ejaculation, with about half losing it after 3 years, and by 5 years, that number jumps to around 90%. Androgen deprivation therapy, or ADT, is particularly harsh on erectile tissue. It essentially suppresses testosterone, which is vital for erectile function. If testosterone is turned off for a year or more, the structural integrity of the penile tissue begins to change significantly. Muscle tissue is lost, and collagen, which is less elastic, replaces healthy tissue. These changes reduce the tissue's responsiveness to medications like PDE5 inhibitors, which are commonly used to treat ED. Most men on long-term ADT will eventually need more invasive treatments, such as injections or implants, because their natural erectile function may be too compromised. Overall, understanding these effects helps us better address the challenges many men face after prostate cancer treatment and highlights the importance of personalized care and early intervention. Let's talk about a less discussed but very important aspect of prostate treatment: ejaculatory loss and changes in orgasm. Many men aren't warned about this beforehand, but it's something they should be aware of. After prostatectomy, for example, ejaculation is permanently gone. It's a significant change, and it's important to understand that. Similarly, after radiation therapy, most men will eventually lose the ability to ejaculate as well. Now, even though ejaculation changes or disappears, orgasm often remains. The experience might be different, but the sensation of climax can still be there, which is a key point. Interestingly, when we look at how men perceive these changes, about 50% say that orgasm is less intense 2 years after treatment. Around 40% find that it stays the same, and surprisingly, about 10% actually feel that orgasm becomes more intense after surgery. The most intriguing part is that no one really knows exactly why these variations happen. It's an area still full of questions and ongoing research. So, understanding these changes and their impact is an important part of the overall journey in prostate health and recovery. So, let's talk about the bottom line. Should every man consider taking sildenafil or tadalafil? Well, not necessarily everyone, but honestly, far more men should be thinking about it than currently do. Here, what the expert consensus suggests. For healthy men over 40, there's a strong case for preventive use. It's about maintaining vascular health before problems even arise. For younger men, it can be useful in specific situations, but we have to be cautious because psychological dependency can become a concern. Men experiencing anxiety-related erectile dysfunction often find these medications excellent for temporary confidence boosts, helping them regain a sense of normalcy. Men who have had prostate cancer, this is often where these medications become essential, although sometimes injections might be necessary if pills aren't enough. And for men on long-term androgen deprivation therapy, PDE5 inhibitors usually aren't sufficient on their own, so additional approaches might be needed. What this all boils down to is that sexual health isn't just reactive, it's preventive. Just like we maintain our muscle, heart, and metabolism through proactive care, the penis deserves the same attention. Erectile decline isn't a sudden event, it's a slow vascular process, and early intervention can really help preserve function over time. So, thinking ahead and being proactive can make a significant difference in long-term sexual health.